A warm welcome to the Tuesday edition of the Our City COVID-19 show. I am Michaela Miller. Today is day 75 of the national lockdown. As commuters are concerned about the increase in taxi fares, we spoke to Transport Minister Fikile Mbalula, who is spokesperson Ayanda Alipane, about this matter. 4 areas in Tygerberg Hospital have locked down after the inspection of the Labour and unions, but the Department of Health say they have no information about the section that have to be closed. We'll have more on these matters later in the show. And now for your headlines. Taxi fares are set to increase next week. Operators have been running at a loss since the national lockdown started. 4 areas of Tygerberg Hospital have been shut down with immediate effect following an inspection by the Department of Labour and unions. George Floyd is due to be buried today after dying at the hands of a policeman in the US, which ignited global protests against racism. And the World Health Organization has upped the fight against the coronavirus by going digital to track and trace cases. On day 75 of the national lockdown, the current number of confirmed COVID-19 cases in South Africa stands at 50,879. There have been 26,099 recoveries and 1,080 deaths. The Western Cape currently has 33,568 cases of COVID-19, 19,101 recoveries and 829 deaths. 66 positive COVID-19 cases have been recorded at 55 schools, resulting in 18 of them being closed for deep cleaning. Western Cape Education Department spokesperson Pranag Hamid said the cases included 2 learners. She highlighted that once a case had been confirmed, those who had been in close contact, meaning a handshake or hug, were required to self-isolate for 14 days from their last contact with the individual. Those not in close contact do not have to self-isolate. Due to privacy issues, the names of the schools will not be released. Tygerberg Hospital is the largest hospital in the Western Cape dedicated to treating COVID-19 patients. Now it has closed its entire kitchen and 3 other areas as a result of an inspection by the Labour Department and unions, which found that the hospital did not have correct health and safety protocols in place. The Health and Other Services Personnel Trade Union of South Africa, Producer and Kasatu, met with the manager on Monday.
What materialized yesterday is I went in, I sat down with the respected management, myself, Producer. I can confirm to say that Kusatu's guys was also present. The outcome of the assessment was that 2 areas was closed down yesterday, and they were issued with compliance letters to decontaminate and deep clean 2 areas in the hospital. I can also confirm to say that the institution does not have a risk assessment plan. They were issued a compliance letter to say within the next 7 days they have to comply and prove to us and gave a respect to the risk assessment plan. They need to indicate in the risk assessment plan that should they not be compliant, what will be done with the respected patients. I can confirm that we from a sponsor side, we take it very seriously. We take it very seriously. We have the best interest of our community at heart, as well as the best interest of our members, who will be employees in the specific states. And from our side, we will do everything in our power to ensure that the workplace is conducive for our members. Now, we're not taking the Department of Labour, because remember the Department of Labour was there, so they've issued the department with a compliance letter to say that they will have to comply. They have to comply in terms of the Occupational Health and Safety Act. The Chief Labour Inspector was also present in the meeting, and it was the Chief Inspector who closed down those specific facilities and who instructed them to come up with a risk assessment, with respect to the risk assessment for the institution. Within the next 7 days, which will be next week Tuesday, we will go back, and then automatically we will automatically inform our members and the community in terms of what the way forward will be.
Nomawetu Sibinkwana, spokesperson for Health MEC, Noma French Mbombo, says no sections have been closed at the hospital, but that 4 non-clinical areas have been identified for further action. A further risk assessment will be done next week with the Labour Department to confirm that the areas in question were adequately dealt with. Staff at another Western Cape old age home who have spoken up about the lack of adequate personal protective equipment or PPE. Caregivers at Hayes Ebenhazen in Stellenbosch claimed that the facility did not comply with COVID-19 regulations and said they had not been paid. A spokesperson for the old age home told IOL 80% of staff had been paid and that the facility had a total of 11 cases. Staff said there had been 3 COVID-19 related deaths at the home and around 20 positive cases. Sinset in Strand as well as Nazareth in Vredehuk have also reported positive cases. Taxi associations say they've been running at a loss since the national lockdown. They are only allowed to carry 70% of the normal load and they are struggling. Some have even had their taxis repossessed. Others cannot afford petrol. In a drastic move, the plan to double taxi fares next week. Our City News reporter Stephanie Pitt takes a look at the issue.
Commuters are up in arms after hearing that taxi tariffs are set to increase come the 15th of June. Taxi operators were due to receive funds in an effort to bring relief amid the COVID-19 pandemic, which is yet to be rolled out. Minister of Transport Fikile Mbalula will engage various taxi associations on Thursday in a meeting where they will try to salvage the situation. We spoke to ministerial spokesperson Ayanda Payne for more on this.
Minister Mbalula was reliably informed that there are certain taxi associations that are looking to increase their taxi fares by well over 100%, in some cases from 11 Rand up to a whopping 30 Rand. He learnt this with a great concern, I must add, because he understands, on the one hand, the plight of the taxi industry. He knows full well that many taxi operators have not been able to operate their taxis because of these lockdown regulations. And those that have been on the road have been transporting commuters at limited capacity. So he understands that a lot of these taxi operators have struggled to make ends meet. They've struggled to even pay for the very vehicles that they're driving. They've struggled to even put food on the table. And while he's concerned about that, he's also urged that these taxi operators are mindful of the fact that they are transporting the poorest of the poor and the working class, who have also been hard hit by these lockdown regulations, some of whom have lost their jobs, or, domestic workers are no longer working 5 days a week, are now working 3 days a week, and their take home is also limited. So he has called for calm. He's called for patience. He's called for understanding. He understands as well that perhaps there is a fare increase that is warranted, but he's asked that that fare increase be mindful of the poor and not exorbitant.
Ali Payne says the government is taking the matter seriously. Several departments were working together to find a solution.
The Department of Trade, Industry and Competition. We have the Department of Small Business Development. We have Treasury sitting around the table trying to find a reasonable approach to assist the taxi industry. Do we pay people per their permits? Do we pay them per their kilometers? Do we pay them for the outstanding number of passengers, or the 30% that they're missing out on because they're not getting the 70%? And how do we do the payments? Do we pay drivers directly? Do we pay operators? Do we pay provinces and ask them to give to the various drivers? So those are just the minor details that are still being ironed out, that will be discussed as well at length and in detail, and also finding a way of assisting the industry to say, if you need to increase your tariffs or your fares, how much is too much? So those are some of the issues that will be discussed at that meeting on Thursday. And then you speak about long-term very quickly. You know, it's unfortunate that this coronavirus landed on our shores at a time when Minister Mbalula was already in deep discussions with the taxi sector, looking at various ways to regulate them, because only when they're regulated can they then be subsidized. I mean, our buses are subsidized, our trains are subsidized. We're seeing various modes of subsidizations in aviation as well as in rail. So why not the taxis? But that critical point is that you can't subsidize what you can't regulate, because we're dealing with taxpayers' monies here. So we're happy that the taxi industry came to the table to say, yeah, let's have this national indaba and talk about ways of regulating the industry. And unfortunately, then coronavirus came upon us. But we were looking to have that indaba in the middle of this year.
On the issue of the taxi COVID-19 relief fund, Ali Payne had this to say.
No monies have been paid out as yet, but yes, an agreement has been reached that it must be given out. And number two, the various modalities have been put in place to be able to carefully administer taxpayers' funds. So the taxi industry is right to complain, to say, we've been waiting for long. When is this money coming through? And we understand and empathize with their plight. But they must also put themselves in our shoes as government to say, we need to make sure that we do things above board. We don't want a COVID gate. We don't want an inquiry that looks into the way that these funds were dispensed. So it's a bit of a catch-22. It's a tricky situation. And we apologize profusely for the delays that have been incurred. But we also appeal for understanding so that the industry can know that we have their best interests at heart, that we have the best interests of the taxpayers at heart. And we're trying to balance out all these various interests.
Yeah. We also spoke to some commuters, and this is what they had to say.
Since the start of lockdown, we all knew that the taxi industry would be one of the industries to suffer. So now that the country is on level 3, taxis are allowed to operate with 70% of its usual capacity. But this means that they are not making as much money as what they did before. So in order for them to make up for all the money that they've lost, they need to consider increasing the price of taxi fare. So now, while we all understand the complaints and the grievances, they need to understand that we're all fighting the same battle, and many people can't even afford the price of taxi fare now during this time. And even if they should increase the price of taxi fare, they need to increase it to a reasonable amount. Because if they should increase it to a price where people can't afford, people's going to seek cheap alternatives, like maybe taking the bus or even finding a lift club, and then the industry is just going to lose once again.
I think it's a bit unfair that amongst all the other increases, that transport fee or taxi fee would also be increased now. I mean, people are already battling just to cover the bare necessities in the household, and now for them to be paying almost double the amount for a trip to work using a taxi is just insane. I mean, if you were usually paying 20 Rand, you would be paying almost 40 Rand just to get to work. And I mean, that's also taking a big chunk out of the income in the household. So I don't think that taxi fare should be increased. And winter is coming, so a lot of people would definitely be using the taxi more often.
Thanks to Stephanie Pitt for that in-depth look at the looming taxi fare increases and the impact of the lockdown on drivers and commuters. As always, our City News will keep you updated on this developing story throughout the week. In other news, a big cold front with strong winds and heavy rain is expected to make landfall in the Western Cape tonight and will last until Thursday. The SA Weather Service said it was expecting wind speeds of between 55 to 85 kilometers per hour. Disaster Risk Management spokesperson Charlotte Powell said the City of Cape Town was on standby to assist residents, while MACO member for Safety and Security JP Smith urged motorists to exercise extreme caution. We continue giving you the latest news from the city, province and around the world. When we come back, we'll be looking at the latest on George Floyd and more. Stay with us. Welcome back. You're still tuned into Channel 263 on DSTV and the Friday edition of the Our City COVID-19 show on Cape Town TV. The battle against the government over the ban of tobacco products is heating up. The Fair Trade Independent Tobacco Association, FITA, will have their application heard in court on Tuesday and Wednesday. Government banned the sale of tobacco at the beginning of lockdown in March. FITA has questioned the National Coronavirus Command Council's authority to make the decision, which it deemed unconstitutional and invalid. At the same time, the Department of Cooperative Governance and Traditional Affairs, COGTA, says South Africans needn't worry about the liquor ban being reinstated and that the rumors that it would return should be treated as fake news. Foreign nationals working in South Africa are not excluded from claiming from the Unemployment Insurance Fund. That's the word from UIF Commissioner Tehobo Marumpin, who said over 88,000 foreign national workers have been paid since the lockdown began. Marumpin said as long as employers and foreign workers had contributed to the fund, they would be paid. Payments have taken longer due to the use of a passport number instead of an ID number. Those needing UIF assistance were urged to contact the necessary labour departments. Moving to news from further afield, one story that continues to dominate headlines around the world is the death of George Floyd and the protests that have followed. The 46-year-old man was killed last month. 4 policemen have since been arrested and charged with his death. Floyd is due to be laid to death today. This report is from Voice of America.
We are here to honor George Floyd.
House Speaker Nancy Pelosi led House and Senate Democrats in a moment of silence at the Capitol's Emancipation Hall. They took a knee for nearly 9 minutes to symbolize the length of time prosecutors say George Floyd, handcuffed and face down, was pinned under a white police officer's knee before he was later pronounced dead at a Minnesota hospital. Floyd's death sparked worldwide protest against police brutality and racial injustice. Over the weekend, thousands more continued to protest. Floyd's death also prompted the National Football League Commissioner Roger Goodell to say that the league was wrong for not listening earlier to players fighting for racial equality.
We, the National Football League, believe Black Lives Matter. I personally protest with you and want to be part of the much-needed change in this country. Without Black players, there would be no National Football League. And the protests around the country are emblematic of the centuries of silence, inequality, and oppression of Black players, coaches, fans, and staff.
Meanwhile, in Minneapolis, Floyd's girlfriend and others gathered at a park on Saturday to remember Floyd and release balloons to honor lives lost at the hands of law enforcement.
Floyd is here with us. He loves us. And I've been wanting for a long time, and whatever religion you are, however you pray, I've been wanting to thank Father God and be with a group of people that love him and support us, and just thank Father God. Thank you, Father God, for giving us Floyd.
Floyd was also remembered in his North Carolina hometown by mourners who waited hours for a glimpse of his golden coffin. And in Houston, Texas, the final of a series of memorials in Floyd's honor, the public was able to view his casket at the Fountain of Praise Church. Floyd will be buried at the Houston, Texas Memorial Gardens Cemetery, where he will be laid to rest next to his mother. Mariama Diallo, VOA News.
Animals might hold the key to knocking out COVID-19 until a vaccine is developed, or so Swedish scientists believe. They've been testing a new treatment or an alpaca named Tyson and are optimistic in going to save many lives. This report is from Voice of America.
Tyson may become the world's most famous alpaca. Researchers from the Karolinska Institute in Stockholm have immunized him with coronavirus proteins and isolated tiny antibodies, known as nanobodies, in his blood. Antibodies are proteins that are produced by your immune system when it senses the body has been infected with a virus or another foreign body. The proteins then try to kill it off. Nanobodies are far smaller than the antibodies humans produce, and nanobodies bind to the same part of the virus that human antibodies do. Gerald McInnery is one of the scientists working on this project.
So these are the antibodies that we took from the alpaca's blood cells, and we can see that those antibodies are bound right on the surface, exactly at the point that the viral protein needs to get into cells. And so this gives us a structural understanding of how these antibodies work to stop the infection.
McInnery says the results will be published in a few months. The work could lead to a drug that would help reduce the amount of virus in a patient's blood, while the immune system develops its own response to the infection.
All the evidence would suggest that it will work very well in humans, but it's a very complex system, so we look forward to getting to do those experiments.
A vaccine could take years to develop, which is why the scientists at the Karolinska Institute focused on developing a treatment. It could help stop the pandemic, while a vaccine is being developed that offers long-term immunity. Carol Pearson, VOA News, Washington.
That's all from the news front. But when we come back, Stephanie Pitt will give us an update on the World Health Organization and what's trending on social media.
You're still watching the Our City COVID-19 show. I'm Stephanie Pitt. The World Health Organization has upped the fight against the coronavirus by going digital with the aim of tracing and tracking positive cases. WHO Director General Dr. Tedros Adhanom Ghebreyesus gives us more information on this development.
WHO has also published new guidelines on the use of digital tools for contact tracing. Many digital tools have been developed to assist with contact tracing and case identification. Some are designed for use by public health personnel, like WHO's Go Data application, which has been used successfully to trace contacts during the ongoing Ebola outbreak in DRC. Others use GPS or Bluetooth technology to identify those who may have been exposed to an infected person. And still others can be used by people to self-report signs and symptoms of COVID-19. As part of a comprehensive approach, digital contact tracing tools offer the opportunity to trace larger numbers of contacts in a shorter period of time and to provide a real-time picture of the spread of the virus. But they can also pose challenges to privacy, lead to incorrect medical advice based on self-reported symptoms, and can exclude those who do not have access to modern digital technologies. More evidence is needed about the effectiveness of these tools for contact tracing. We encourage countries to gather this evidence as they roll out these tools and to contribute that evidence to the global knowledge base. We also emphasize that digital tools do not replace the human capacity needed to do contact tracing. Starting tomorrow, WHO is convening an online consultation on contact tracing for COVID-19 to share technical and operational experience on contact tracing, including innovations in digital technology. As part of our commitment to coordinating the global response, WHO is also running the COVID-19 Partners Platform, an online tool that enables countries to match needs with resources. This online tool enables countries to enter planned activities for which they need support and donors to match their contributions to these activities. So far, 105 national plans have been uploaded and 56 donors have entered their contributions, totaling $3.9 billion US. The platform also includes the COVID-19 supply portal, enabling countries to request critical supplies of diagnostics, protective equipment, and other essential medical provisions. So far, WHO has shipped more than 5 million items of personal protective equipment to 110 countries. We're now in the process of shipping more than 129 million items of PPE to 126 countries. More than 6 months into this pandemic, this is not the time for any country to take its foot off the pedal. This is the time for countries to continue to work hard on the basis of science, solutions, and solidarity. I thank you.
Moving on to social media, we posted a question on our Facebook page about what your views are on the proposed taxi fare increases. These are some of your comments. Kanya Lumkwama says people should opt for buses as a way to protest this. Taxis have been bullying people for too long. Sandra Janki says, I would rather take a bus than a taxi. They are rude and inconsiderate. Bernadette Dowrit says, I will get on the bus. They have been filling taxis to the brim and do not comply with regulations. I will not be supporting them. Fano Ngubo says, then the state should enforce they all are SARS compliant. Alton Joseph says, 99% of the taxis aren't even roadworthy. It seems, It seems as though people are feeling as if the taxi increases are coming at the wrong time. Now let's take a look at the popular hashtags on Twitter today. Hashtag UWC must fall. Students at the University of the Western Cape are due to start exams next week, but many still haven't received data or laptops that would enable them to study online. They are not impressed and worried. Hashtag Day 75 of the lockdown. Cyril Ramaphosa has sent his condolences to all families who have lost loved ones to COVID-19. His message to the nation comes as South Africa's death toll passed the 1,000 mark. We'd like to know your views on burning issues during this pandemic, so we'll be posting burning questions on our Facebook page daily, Our City CT. You can also follow us on Twitter at Our City CT. That's it from me, Stephanie Pitt. After the ad break, Michaela Miller will be sharing important information on resources and places of safety you can access during this period. Stay with us.
Welcome back. You're still tuned into Our City, the COVID show on Cape Town TV, channel 263. Here's a recap of today's headlines. Taxi fares are set to increase next week. Operators have been running at a loss since the national lockdown started. 4 areas of Tygerberg Hospital have been shut down with immediate effect following an inspection by the Department of Labour and Unions. George Floyd is due to be buried today after dying at the hands of a policeman in the US, which ignited global protests against racism. And the World Health Organization has upped the fight against the coronavirus by going digital to track and trace. If you are in need of any assistance, here are some organizations helping communities stay safe during this period. That's it from the Our City COVID-19 news show, but we will continue giving you the latest news on what's happening in Cape Town on our Facebook page at Our City CT and on Twitter at Our City CT. You can also get in touch with us via email on ourcity@capetowntv.org or call us on 021 448 0448. From me, Michaela Miller, and the Our City News crew, goodbye.